So you are defined as having a pre-existing condition, even
Right.
though you're a healthcare worker.
Exactly. I still have to see my oncologist every 3 months, as a matter of fact. So I wasn't supposed to go back to these units from what I was told.
But you ended up going back to this unit, not only to this corona floor, but your hospital, currently the largest number of cases in Georgia, are at the hospital where you worked.
We're one of the leading. I don't know if we're the top ranked. I haven't checked the latest numbers, but we have a pretty large amount of cases at our hospital.
So you have this huge, influx of people coming in, diagnosed and not, but showing symptoms. You already have a compromised immune system. And to add to that, as I understand, you felt that you didn't have the proper protective gear that we're hearing so many other healthcare workers talk about around the country.
There's a nationwide shortage of PPE, protective personal equipment. So we're being required to reuse the same gown and same mask the entire shift. I, as well as others, we don't feel that that's safe, because prior to this pandemic, that's not how we did it. If we went into a room, came out, had to go back in again, we got something totally new. So, yes.
So when I saw the video, I thought, did she snap? Had she been fed up? Because listen, all the healthcare workers I know, I've got nurses in my family, y'all do this because you love this job. You want to help and serve people. Was this a snap decision? Was it a rash decision?
Okay, let me just say that I reacted out of stress, fear. I was already, worried about everything, because my husband expressed the concern that he didn't want me to go because of not having the protective gear. He said, if they don't have the supplies to protect you, you don't need to be assigned to those patients. He's away. Another concern is he's working in another state. If I were to come into contact with something and have to be quarantined, there's no one here to care for my children. I'm their primary provider right now. So there were a lot of factors behind it. I love my job. Let me just say that. I've been a nurse for 3 years now, and I care about my patients. I did not want to leave my job.
Do you want to go back? Do you want to rejoin your colleagues or a different hospital and get back out there and deal with these cases and help people?
I worked hard for my nursing degree. Of course, I don't want to just give up nursing. That's not even the thing. And I loved where I worked. I doubt, since I went to social media, they're not going to let me come back. And I do regret how I handled it. But like I said, you're not thinking clearly when you're upset. I have a great working relationship with all of my coworkers. They don't agree with how it was handled. If the opportunity were there, of course I would go back. There's still other patients that need to be cared for. I regret how I handled it, because if I would have remained calm and just thought it through, I wouldn't be here right now.
Real quick, do you have a message to other healthcare workers who might be at that brink, whatever the circumstance, where they go home and they just feel that this is too much to handle? What's your advice?
What we're going through right now, it's very important, and we need all the help that we can get in the healthcare field to combat this epidemic, or this pandemic, I'm sorry. But at some point, your life matters, your health matters, your family matters. And I just feel like I was left with no other choice, basically. Just, I don't know, show compassion in situations, act like you care about your colleagues, and we can get through this together. I mean, there's a way to handle things, basically.
Melissa, thank you so much for talking with me. I can hear it in your voice and your words that if you had it to do again, maybe things would have played out in a different way. But the stress is tough, and at least we appreciate you sharing your story beyond what we saw on social media. Thank you so much, Melissa.
Thank you for having me, Tamron. Thank you so much.